Ladies and gentlemen, good afternoon. Firstly, I would like to thank the organizing committee and the Hong Kong Jockey Club for giving me the opportunity to speak in front of such a floor. Immunocastration and racing regularity. It is a story of a good idea, which is not a good idea. All of us, the vets, we want or we wish to find a solution for the castration and the surgery. And the right criteria for an alternative solution are to be less risky and reversible. The mechanism with the immunologic castration is to intervene on the GnRH hormone. It is a gonadotrophin releasing hormone, which is between hypothalamus and pituitary gland. And under this hormone, the pituitary gland secretes LH, FSH in order to stimulate ovaries and testes and to give the sexual hormone. And what we are going to do is to use our antagonist. It was done in the past, but the problem of the antagonist is to be catched very easily, or more or less easily, by the laboratory. And now we have on the market an anti-GnRH vaccine. Two vaccines are available and can be used in horses. The first one, comes from Australia, and it has been marketed for the mares, and it is called Equity. Another one is marketed in Europe, not for horses, but for pigs, and can be also used in horses. The only difference between the two vaccines are the adjuvant and the antigen dose. The efficacy is real. So 2 months after the primary course, on colt, there is a decrease of the testosterone level, of the sexual behavior, of the number and mobility of spermatozoid, and the size of the testicle. And the duration is at least 4 months. On female, it is a decrease also of the progesterone level, a stop of the sexual cycle, and a decrease of the ovary size. The duration of action is a little bit more, at least 6 months. We have some side effects, and fever and local inflammation can be seen with all the vaccine. But what is the problem with the GnRH vaccine? It is the level and the time for the resumption of the normal sexual activity. After 2 injections, a part of the treated colt and the female would need a treatment in order to recover their sexual activity. And a part of them wouldn't recover it. On the welfare point of view, the anti-GnRH vaccine use seems to be a better solution than the surgical one. But we must see that in detail. From a racing point of view, the immunological castration gives a mismatch between the sex of the animal and its hormonal status. And this use of these techniques poses many difficulties. Some races are restricted to males or to females. It is the case in France for Arc de Triomphe, and could not be open for temporarily castrated horses without introducing a confusion for the public and the punters. But more of that, on colt, the resumption will be sometimes very difficult. 25% of the horse need a daily hormonal stimulation to recover a normal sexual activity after the effect of the vaccine. But 30% of the horse don't meet with the hormone therapy and stay gelding. For the female, the figures are not very clear and depends on the work done, the scientific work done. but there is a significant risk of persistence of the sexual neutralization. For some manipulation or for some use of the horse, by example, the pregnancy, we can solve the problem with a wide information of the public and the painter. But in the case of the immunological castration, even if we have all the relevant information, it is very difficult to say how the effect on the horse behavior and what effect on the performances will be achieved. On the top of that, the GnRH vaccine is a prohibited substance according to Article 6 by acting on the reproductive system and the immune system. So its use on horses is therefore not permitted. A recent study of Dr. Bonnet showed that vaccinated cold produce antibodies, and the detection of antibodies is linked with an important decrease of the level of testosterone, estrogen, and sexual hormones. At sales, it is also a difficulty. Presenting a horse as a colt or as a filly presupposes a reproductive capacity. If the purchaser ignores a vaccine has been done, he may invoke a defect in the destination of the animal or even fraud. For selection, it is also a problem. The use of castration is linked to the difficulty to train or to raise horses. And you know better than me that the refusal to work, the risk of accident or the sexual disturbance are a real problem which leads to the castration of horses. The fact to establish a racing record that could not be obtained without castration introduced an important bias. The use of the GnRH vaccine on racing horses is not a better solution than the castration, as this method introduces several problems and especially brings confusion for everybody. Consequently, the use of the GnRH vaccine is considered a practice incompatible with the participation in an official race held under the international agreement. Thank you for your attention.